Yeah. So before CHS was a headline term, what were those early ER cases like? What made you realize something bigger was happening?
Yeah, we have seen patients in the emergency department with this broader sort of concept of disordered gut-brain interaction, bad bellies. We've seen this for decades. I've been practicing emergency medicine for a long time. It's not a new concept that people are showing up with terrible belly pain, nausea, vomiting. It's a worsening concept. And that really, I think, drives one of the principal things that I like to preach and sort of hold high with cannabinoid hyperemesis syndrome is that it's a real problem and it's common, but it's also commonly misdiagnosed and overdiagnosed. It's part of a broad misunderstanding and new understanding of people with long-standing bad bellies that we can't seem to figure out when their lab tests are normal and their CAT scans are normal. And certainly for patients who have significant cannabis use, cannabinoid hyperemesis syndrome is a real problem, a real possibility. At the same time, cannabis can be a real savior and helpful medication for people with quite the same problem.
So people experiencing cannabis hyper like CHS can actually utilize cannabis to help deal with symptoms of CHS? Is
Well,
that what I'm
so
gathering?
no, I'll back it up a little bit more.
Yeah.
We look at cannabinoid hyperemesis syndrome as a really diagnosis of exclusion, right? There are poor diagnostic criteria for how you get labeled with CHS. We use something called the Rome Foundation's Rome 4 criteria. And while that sounds fancy, it amounts to you're puking your brains out all the time. We can't figure out why, and you smoke weed. That's the diagnostic criteria.
That's
And
what
the label,
CHS pretty
that's
much
about
is.
it. That's about it. That's the diagnostic criteria that we throw onto it. And then certainly we say it, and then you stop smoking weed and you
Yeah.
get better. Okay, all right. The problem is this, and it's an important one, is that there is profound overlap between that diagnostic criteria and many others, including cyclic vomiting syndrome in patients who happen to use cannabis.
Cannabis.
And so what we've seen is really a misunderstanding of what's going on here. But that's the headline here is that this is not unique to cannabinoid hyperemesis syndrome, but cannabinoid hyperemesis syndrome and cannabis users are certainly feeling the effects of the lack of knowledge around this.
Yeah, definitely. Most people think CHS is either you're puking or you're fine. How do you explain that spectrum you see in real patients?
I appreciate that question because I think that's really where it begins is that cannabinoid hyperemesis syndrome, like all things, manifests differently in different people. We understand that in some people is some morning nausea until they smoke. We understand that CHS for some people is puking their brains out and their potassium levels are so low that their heart might stop. And so what we have done is we've researched this, right? There are fantastic efforts throughout the country to understand this a lot better. And we have conclusions from medical societies and from others saying things like it's a consequence of high dose and high frequency cannabis exposure. It's a consequence of this and it's a consequence of that. But at the same time, the best bench research we have, the best sort of actual blood test that we have in these individuals actually points toward a genetic predisposition. And so what we have is a scattered data landscape, which is frustrating, but ripe for innovation and ripe for opportunity. And that sort of decimated sort of field of evidence out there can be picked and can be identified that this is a multifactorial problem. It is a consequence of high dose and high frequency cannabis exposure. It is a consequence of genetic predisposition. It's a consequence of a number of other things as well. And I think that the important concept is that we not limit it to a sort of narrow interpretation. This is because you're smoking too much weed, when in reality, this is a complex issue, and there are a number of underlying components. And it could be that you're smoking too much weed, but it's
Yeah.
probably more complex than that.
I find with